Hello, everyone. This is an Arab Talk radio special report. We've been talking to several journalists and colleagues across the Middle East and beyond to report on the impact of the coronavirus on their communities. This is my conversation with journalist Daoud Kuttab, reporting from Jordan. Daoud Kuttab is a Palestinian journalist, media activist, and columnist at Al Monitor. He's also Director General of Community Media Network, a not-for-profit organization dedicated to advancing independent media in the Arab region. Joining Arab Talk from Amman, Jordan is a renowned international journalist, Daoud Kuttab. First, thank you for coming on the show, Daoud, during these difficult times, and hope you and your family are doing well.
Thank you, Jamal. No, we're fine. Thank you so much.
So, Daoud, you're in Amman, Jordan. You travel, of course, between Jordan and Palestine. And first, let's talk about what's happening in Jordan. I've checked this morning. It seems that at least it was reported that there are 400 cases. I don't know if the numbers are accurate or not, but how are people coping and what's the government doing about it?
Well, the government has taken a very strict and very strong position. The military order or defense order was established mid-March, and we've had 6 orders so far. The government has put a round-the-clock curfew almost since then, since the March 21st, actually. And they're starting now to ease things, but it's been a very strict army-controlled situation. And that has kept the numbers down. As you said, we have less than 400 cases. About half of them have already been healed. So we're actually down. The curve is going down. 7 deaths have happened, mostly older people with pre-existing conditions. So generally, I think they've done well. Most of the public has adhered to the curfew orders. There have been a few cases here and there, but largely it has worked very well.
So what's the effect on the economy? I know that's the main concern in Jordan, and I think with the high unemployment and Jordan depends a lot on small businesses, and so with the shutdown, how people have been reacting about this?
Well, the economy has been devastated, as it has been around the globe. It's not just Jordan. What the government has done is a few things. They lowered the Social Security tax that is taken from the employers and employees from 21.5 to 14 to 4. So they removed almost 16% of the payroll tax. They have opened up the coffers of the Social Security to provide cash installments to people who needed small amounts of money. They also included people who don't have regular jobs, taxi drivers, people who work in self-employed people, because they're the hardest hit. And then today the tourism minister announced a $10 million input from the government to help restaurants and hotels and so on, have really been devastated by this, because tourism has totally come to a total stop. I mean, not even 1% in tourism, because the airplanes have stopped and the people cannot even do inside the country tourism. Everything is closed. So it's been a devastating hit. But the alternative for the government of Jordan was that if they allowed the economy to continue, there will be many, many more cases, and the medical establishment here is not able to withstand a large number of people going to hospital. They don't have ventilators. They don't have good PPE equipment. So they chose the kind of easiest and cleanest way of protecting people by just forcing them literally to stay home.
And I've been watching some good things happening from the government, seeing the Jordanian army, in certain cases, bringing bread and water to neighborhoods, and people helping each other in different ways. A lot of heartwarming stories coming out from there.
Absolutely, absolutely. It's been very It's a perfect story. As you said, the army has actually taken on a social role of helping people out. The army is not doing it out of spite or out of restriction, but out of really protecting the people. So people have been very much greeting and thanking the army for what it's doing. And yes, bread and water has been actually, there's been too much bread. People are actually giving away bread at local supermarkets. The government, it did an interesting thing. They allowed local supermarkets and shops to open, but they kept the big ones closed, and they kept the cars closed off the road. So basically, you can walk to your nearest kind of 7-Eleven type store, if you will, and buy your milk and bread and eggs, and you don't need much more. I mean, you need to live kind of a simple life, which in a way is good. And as you said, neighbors have been helping out, churches and mosques have been helping out. Lots of initiatives of local committees are being established to help out people. We have in Jordan 10 million population. 3 million of the population are refugees or people or foreign laborers who don't have actually a regular job, and they're not on social security. So there's a lot of people who need help. Almost all the taxi drivers are self-employed, and they are totally without any income. So there's a number of sectors of society that are really hurting by this. And people have all to learn how to live with less, and learn when they go shopping that to stay distancing from each other. There's a lot of hand washing that is being taught and learned, and basic hygiene issues are learned. And the army and the government move very fast whenever there is a discovery of a family or building that has infection. They really close it off, and then they test everybody, and then they make sure everybody is safe before they can go back. In the beginning, they opened up the 4- and 5-star hotels where people coming in airplanes basically were forced the quarantine. My daughter was one of them. She came back from Princeton, and they took her right to the Dead Sea, and she stayed in a room overlooking the pool, but she couldn't get out of the room. it was quite difficult. But anyway, it was welcome because the government really went out of their way, and a lot of businesses have been contributing money, and there's been different funds that have been established. Tens of millions of dollars in JDs have been put aside by big companies, banks, and so on. And individuals, you can donate as much as $1 on online now. 70% of students are studying online. Many companies, my company included, have been doing. I have been working out of home for the last 30 days, and I haven't had to go out much for anything except to buy bread and milk and things like that. So things are not good economically, but I think there have been some remedy to the big problems.
I forgot to wish you when we started Happy Easter, and this is something. I mean, we're all kind of like we all miss celebrating holidays, and I was worried about people across the globe, especially in the Middle East, Jerusalem, where people go to churches, and especially in Jerusalem and in Jordan, celebrate Easter. So how was that done?
Well, as you said, people in this part of the world are more spiritual, more conservative, and times of crisis actually is a time for people that need that spiritual help. But people are learning. The many church services we have Palm Sunday. Actually, we do the Easter by the Orthodox calendar. So yesterday was Palm Sunday, and so people went to church using Zoom. We had church service using Zoom, and it seemed to work. It was okay. It wasn't the best, but it seemed to work. The big problem, of course, is going to be the Passion Week in Jerusalem, as you said, because it's very physical. The Via Dolorosa, the walk of the cross, and the washing of the feet, the different celebrations, and then the holy fire that comes out of the Holy Sepulchre. So you cannot do that virtually, and so apparently I spoke to the spokesman of the Orthodox Church. They're having some arrangements to get the light out, because every year the light goes out to the entire world from Jerusalem.
Right.
And a number of Orthodox countries or Orthodox majority countries like Russia and others are literally sending airplanes to pick up the light, because people are actually wanting that light because of their spiritual connectivity to the resurrection and story and so on. And so they're still going to spread out the light, but as you know, in Jerusalem, the church was crowded. So
I know you cannot even walk in the old city on
During that.
awaiting the light coming out, and now there's going to be very few people there. But that's a tradition that is very important to people, and spirituality is important, especially in these times. And people are learning to adjust. It's amazing how much technology has provided some alternative. Obviously, a lot of people are not up to date on technology, and there's been a lot of younger kids helping their parents and grandparents deal with technology, and it's fine. I mean, people seem to be doing okay. Not the best, but it's okay.
It's working out. Talking about Jerusalem, what's your impression on what's going on in Palestine? In Palestine, I've checked today. They say they have about 300 cases, but then people have been complaining. They feel that maybe the numbers are too low because we've recently witnessed a spiking in the Jerusalem neighborhoods, like of Sur Bahir and Silwan. Any updates on this?
Well, there's two things here, Jamal. I mean, the big problems are actually Gaza and Jerusalem, because they are communities that are not easily regulated, very densely populated areas, and so the fear that once the pandemic reaches these places, it'll be very hard to control it. So far, it seems that Gaza has had very few cases, and they seem to have isolated them. But as you said, there's very few testing going on, and so unless people are actually having the symptoms, you don't know what is happening. The second problem is that a lot of the workers who work, there's about 70,000 Palestinians from the West Bank and East Jerusalem who work in Israel, and Israel has had a very high number of people who have the corona, and so during the Jewish Passover holiday, they all returned, and there was an attempt to try to control that, and then it was the Israelis were not very cooperative, so people were coming in uncontrolled, and they were trying to isolate or at least test them or make sure they don't have the symptoms. So that is a problem. But I would say that Jerusalem is the biggest problem, because it is the kind of forgotten area, East Jerusalem specifically, because the Israelis paid very little attention to the situation in Jerusalem on the Arab side of the city, and the Palestinian government has not been allowed to work there. And the few efforts by the Palestinian officials who live in Jerusalem have been thwarted by the Israelis, who arrested the officials, saying you're trying to use the pandemic to, for political gains, and they actually literally intimidated him, beating him up and forcing him to wear a mask with blood on them. And it was quite nasty what they did to Mr. Fadil Hidmi, the Palestinian Minister for Jerusalem Affairs, and also Adnan Ghaith, who was also arrested. So the Israelis have not been cooperating or allowing the Palestinian government to work, and as a result, in an ironic way, the Israelis have helped create local committees that we used to have in the Intifada days. You remember, Jamal. Now there's a local committees that are being established. There's the alliance of the Jamal al-Maqdisi at Jerusalem Alliance of about 71 NGOs that are working with the WHO and with the Jerusalem hospitals to come up with a plan, and they've made quite a good plan. They've designated hotels to become quarantine hotels. One is for the doctors who come from the other West Bank cities, and instead of them going back every day, they decided to keep them in Jerusalem for their own protection, so they don't have to go cross checkpoints every day and so on. And they're trying to raise money. The hospitals need about $7 million to buy the ventilators and the personal protective equipment. And so They have, I think they've raised about $3 million already, so that's quite good. They still need some more. And I call your audience if they're interested to support the hospitals in Jerusalem. And there is attempts to create a lot of awareness. The big issue is awareness. The more people are aware, stay home, clean, wash their hands, stay out of big groups, I think that's the best kind of protection against this pandemic.
And there was a story that Israel, of course, I should mention Israel has 11,000 cases as of today, that they've been procuring medical equipment, utilizing the Mossad, basically. There was a story about how they've been getting that. And
they got some bad equipment also.
They got some bad equipment.
Testing results that were bad. Unfortunately, the Israelis have politicized this issue, and especially in their relationship with Gaza. They're trying to blackmail the Gaza population by saying, we will give you the ventilators if you release information about some of the Israeli soldiers that were held by during the conflict. And apparently there's some kind of a discussion about prisoner exchange. So, it's quite interesting, but in a way sad that this pandemic is used for political reasons, whether it's with the Palestinians or even in the Israeli government establishment itself. There's a lot of politicization of this issue.
Thank you, Daoud, and stay safe and healthy, and hopefully we can talk during better times.
My best to you and your family, Jamal, and everybody who's listening and watching us. I hope things are better the next time we talk. Have a good day.
You too. Thanks.